The abdominal aorta bifurcates into the right and left common iliac arteries at the level of the fourth lumbar vertebra. Each common iliac artery ends at the pelvic inlet in front of the sacroiliac joint by dividing into external and internal iliac arteries. The external iliac artery runs along the medial border of the psoas muscle, following the pelvic brim, and gives off the inferior epigastric and deep circumflex iliac branches. It leaves the falx pelvis by passing under the inguinal ligament to become the femoral artery. The internal iliac artery passes down into the pelvis to the upper margin of the greater sciatic foramen. There it divides into anterior and posterior divisions. The branches of these divisions are numerous and supply the pelvic viscera and the gluteal region. Today we are going to learn three branches which participate in blood supply of the lower limb: the obturator artery, inferior gluteal artery, and superior gluteal artery. The obturator artery runs forward along the lateral wall of the pelvis with the obturator nerve and leaves the pelvis passing through the obturator canal. Superior gluteal artery leaves the pelvis through the greater sciatic foramen above the piriformis muscle. It divides into branches that are distributed throughout their gluteal region. Inferior gluteal artery leaves the pelvis through the greater sciatic foramen below the piriformis. It passes between the first and second or second and third sacral nerves and supplies the muscles of the gluteal region too. Additionally, the superior and inferior gluteal arteries contribute to formation of the trochanteric and cruciate anastomosis around the hip joint to supply the head of the femur. The trochanteric anastomose is located near the greater trochanter of the femur. It is formed by the superior gluteal artery, the inferior gluteal artery, the ascending branch of the medial circumflex femoral artery, and the ascending branch of the lateral circumflex femoral artery. The cruciate anastomosis is situated at the level of the lesser trochanter of the femur. The inferior gluteal artery, the medial circumflex femoral artery, the lateral circumflex femoral artery, and the first perforating artery and branch of profounder artery take part in this anastomosis. The tiny branches of these vessels, the retinacular arteries, are sent along the capsule of hip joint to assist the artery of the head of the femur, a branch of obturator artery, in supplying of the head of the femur. The branch of obturator artery, which comes here along the ligament of the head of the femur, is insufficient in adults. That's why the intracapsular fractures of the neck of the femur with damage of the retinacular fibers of the capsule commonly lead to avascular necrosis of the femoral head.